Welcome to The Bone, the podcast that goes deeper. Here we cut through the noise and get straight to the core of the issues that matter. From real stories to raw truths, we dive deep into the conversations that shape our world and challenge our thinking. We're not afraid to dig in and get to the marrow of it all. Whether it's life, culture, or business in sports medicine, we're here to break it down raw and real. No filters, no fluff, just to the bone. With your host, Shelby Daly, we're getting to the bone. This is a clinically pressed, approved CEU podcast. Find the quiz to gain credit at clinicallypressed.org/courses. Clinically Pressed Company, making the complicated simple through results that give back. Find out more at clinicallypressed.org. Let's get started.
Welcome back to the Bone. Today we have Mitch Hauschildt, and he will be talking about the theme of bridging performance and rehab, the evolving role of the athletic trainer. So, Mitch, you've been in the sports medicine field for over 2 decades and now oversee prevention, rehab, and performance for more than 550 athletes at Missouri State. What originally drew you into athletic training, and how has your perspective on the profession evolved over the years?
Yeah, hey, great question. Thanks for having me on. I do appreciate it. Yeah, things have definitely evolved. I mean, I don't feel that old, but I guess looking back on it, I've been in the profession for a long time. So I've worked on the private side in a hospital-based clinic, and then I've been in the Division I university level for 18 and a half years or so, something like that now. So, I mean, I think that, the things that stand out in sports medicine that have evolved, a lot of it's related just back to the science of how we do things and, how we progress, and technology. I do think technology is probably the biggest thing that stands out. We used to do things pretty simply with a lot of simple tools. Now we've evolved into like force plates, a lot of monitoring with our athletes that give us tons of data, tons of information, and, a lot of high tech solutions versus when I first got into this, it was a lot of low tech, ice, stem, ultrasound, some exercises, call it good. And now we've really progressed a lot over the years with really a lot of the technology that exists out there.
Yeah. Well, I know I've seen a lot of debates about, ice is one of the big ones right now of do you use it or do you not? And I mean, with these progressions in the technologies, do you think the basics that we've used over the last few years are still, would it hurt someone to still use those, or do you really need to keep with the times, do you think?
Yeah, no, I think another great question, right? I think I'm an all the above guy, right? Like, I actually think there's room in our tool bag for all the different tools, all the different modalities. And yeah, it's like things kind of come and go, right? And they evolve. And I've got friends that are like, no, never use ice. We should never do that. And I'm like, I understand the point, right? And I've never been a big user of ice, just I think because of my world of I'm more injury prevention, more rehab, where my coworkers that are a lot more acute have historically used a lot of ice. Now they're backing away from that a little bit. To use that as an example, ice still has great pain relieving effects. And there are times where our athletes, that's what they prefer. And the reality is if our athletes are bought into a treatment, the odds of us having a success are fantastic. If they aren't bought into a treatment, they're not quite as good, right? And so I think there's just a little wiggle room in there. We can be guided by the science, but I think we still have to go back to there's room. I mean, I don't use ultrasound hardly at all, but there's a few cases that I've seen, like tenosynovitis of a distal hamstring tendon. Like, actually, you know what? I've had pretty good success over the years with using a little bit of ultrasound there. That's about the only time I can remember using it, but I do think there's room, there's applications for all of the tools, old and new, and we're going to continue to evolve over time with bringing in new tools, new technologies, but that doesn't mean we throw out everything that we've ever done.
Yeah, I would agree with that. I think, patient preference, I think, is part of the big picture of the science. Is taping a Tylenol to their leg and it feels better. I don't know. It works in the moment.
Yeah, no question. And, the whole placebo thing, people always have a negative connotation of placebo. And I'm like, at the end of the day, better is better, right? And as long as what I'm doing is safe and effective, then if they get better, then hey, let's go for it. And so to your point, like if I tape a Tylenol to their leg and they feel better, that's not dangerous. So am I hurting them by doing that? No. I mean, and so that's kind of something I adopted from Dr. Perry Nicholson a few years ago. He's like, listen, better is better. So a placebo, I think that's a positive thing if I can use a tool or get my patient bought into something and it's safe and effective, then let's run with it, right? And so yeah, I definitely think the power of the mind, and I can give a lot of examples over the years, especially the amount of traveling and teaching I've done of some patients prefer to go to like very traditional sort of old school chiropractic care. Other patients want like really new age PT clinics with all the bells and whistles. And the reality is both can be very successful. It comes down to what patient expectations are. And sometimes we have to educate them as to why we feel one is better. But at the end of the day, when they're bought in, the odds of us having good success are significantly higher.
Yeah. Well, with your background, you wear a lot of hats: athletic trainer, educator, consultant, innovator. How do you balance these roles, and what skills or mindsets have you been key to keeping you effective across such different spaces?
Yeah, I'll also throw dad and husband. I got 4 kids
Those
and
are
an
important.
awesome wife, and those are important things too, right? Yeah, how do I balance all those things? Well, for one, I've got everybody involved that I work with understands all of that, and I'm very upfront. Even the University of Missouri State where I work every day, like I'm very upfront. We've got a training room with of athletes right now. I'm like, hey, I'm going to go jump on a podcast real quick. And they're super supportive. And because they recognize the big picture that there's positives that I get out of these experiences that I bring back into the training room. Same thing with some of the companies that I consult with and that I educate for. They realize that my athletic training room is my lab, that I try and test things every day. And so they're okay with me maybe not being full-time for them because actually my part-time brings more information to them than me being full-time just working with them. So number one, everybody's really understanding, and I just over communicate and make sure everybody's on the same page. And that's been really big for me. So communication, time management, like time management's everything, being organized and having a master calendar and just moving parts around so I know where I'm supposed to be at any given time is big. And so then it's really just a matter of, hey, I need to be here when I need to be here at this time, and occasionally I drop the ball, but again, it's organization, communication, understanding, and then I think above all of that, sort of the highest tier there is really a commitment to excellence. And because without that commitment to excellence, then you don't have people that are understanding or people that want to pursue you. So, if I'm talking to my student athletic trainers or younger athletic trainers in the profession, like show that you want to be here, that you want to excel, you want to get better. And then suddenly all the doors start to open up, and then you can start to kind of pick and choose how you put those things together. So
Mhm. Well, I like to give an introduction of how I know you. It's more of a 6 degrees from Kevin Bacon, but
yeah,
Ethan
right.
Kreisworth at Rock Tape, you guys work together pretty closely. Getting involved in all these different companies, Rock Tape, Master Drag Needling, Fringe, is it just your curiosity, or are they pursuing you?
It's a little both. And Ethan is one of my dear friends, and I love Ethan to death. And we always used to laugh when we were both teaching rock tape a lot. We were like the Arnold Schwarzenegger twins movie, right? Because I'm 6'5" and Ethan is, I don't know,
Prawns and
what
prawns.
is he, 5'7", right? And
Yeah.
I've got a number of pictures with my arm around him, and he's kind of up in my armpit, and we just love it. We both he's a wealth of knowledge. I learned a ton from him over the years, and we've always shared a lot of ideas. And again, we share a passion for this profession and also thinking outside the box and recognizing that, not to get on some soapboxes, but, right, wrong, or indifferent in the athletic training profession, it is hard to get ahead, right? It's hard because there's so many hours that are demanded of us and so many different people pulling at us, and the pay is not great most of the time. And it's like, how do we start to turn that corner to get ahead? And he and I have always been really trying to think outside the box to help our own families and help ourselves. So we've always shared that as kind of a common theme. Now, when it comes to the companies that I've worked with, honestly, it comes back to what you just said, right? Sort of 7 degrees of Kevin Bacon. To me, it's my network that has evolved. And years and years ago, this whole thing started because I was doing some kind of interesting speed training when I was in a private setting with Woodway treadmills. And somehow the word got back to them. They're like, hey, let me see what you're doing. We're trying to design these treadmills a little bit better. And they flew me up to their factory, and we talked about some different things. And then they started kind of giving my name out to some customers. So I started doing these little in-house continuing education programs for their customers. And then working a booth, and I got introduced to the TRX guys. And then I went to dinner with them, and all of a sudden they're like, yeah, this is really cool. We're starting the sports med program. Would you be interested in helping us out? And then they introduced me to these ultimate sandbag guys. And then I spoke for them, and they introduced me to Perry Nicholson. He was like, hey, you should come work with Rock Tape. They're awesome. And then when I work with Rock Tape, then it's like Pesci Education. And so it really just becomes kind of, when you get into that network, get into that circle, of speaking and teaching, then you get more opportunities. But really, ultimately, it comes down to a network. And so again, if I'm speaking to my students or younger professional, my advice is always like, go out and just be a good person and be somebody that other people want to be around, and help people out whenever possible, because you never know what kind of doors they're going to open. This is a tight-knit community, and especially like in the college athletic training profession, everybody sort of knows everybody, and that's good and bad, right? So if you don't treat people well, that's going to get back to you and kind of bite you. But if you do, people want to help, and people want to make people better. And so again, kind of goes back to building on what I said a minute ago of like dedication to excellence, organization. If you do those things, you treat people really well, doors seem to open. At least that's been my experience.
Yeah. Well, so in my DAT currently, we've talked about, evidence-based practice and then cutting edge. With the cutting edge stuff, how do you navigate what's going to be true and what's kind of the bullshit ultimately with all these new things that are coming out?
Right. It is interesting, and it's tough. And there's, Rock Tape, we've always said we want to be evidence informed, not necessarily evidence based. And, my evidence based practice friends that define themselves that way, like, I love them to death, nothing against them. But so many times they're like, hey, if the research doesn't say it, I'm not willing to do it. And what they're forgetting is true evidence based practice, if you look at the definition, is not only the research, that's one part, but the other two parts are clinical expertise. So the things that we see in our clinic every day that we can't always explain, but we know they work. And then our patient values. What are our patients telling us they want to do and they work? And all three of those are supposed to have the same weight. Unfortunately, evidence-based practice has gotten manipulated in this point where the research is really big and these other two components are just sort of there and nobody really wants to pay attention to them. So I think there has to be equal value to all of that. Yes, I have to do things that are grounded in research, but I also have to look at the stuff I see every day in the clinic and be like, not sure exactly why that works, but I know that it does. Like, I actually just had this really cool discussion this morning with one of my coworkers who's doing a bunch of education through Z Health. And we were talking about looking at eye movements as it relates to knee range of motion. And he was kind of helping me with what his experiences are. Like, how do I draw that map between this knee? I don't know. I can come up with some theories, but the reality is if I see that it works, let's run with it. Again, as long as it's safe and comfortable and achievable and reproducible and all those things. So back to your question, I think there has to be a good give and take. If we aren't willing to put our neck out there a little bit and try some things that we don't always understand or we just have a hunch on, then we don't advance the practice. But there still has to be some sort of research that we're grounding everything in. Otherwise, we are setting ourselves up for failure. And truthfully, when push does come to shove, we're really out there on an island if, God forbid, something crazy ever happens and goes downhill. So I think there's a healthy middle ground. There's sort of a tug between the two. I'm not sure what the reference there that's the best, but we need to be groundbreaking, willing to think outside the box, willing to, and not to belabor the point, but my first job, and I always have said this, Dr. Bernie Griesmer, who's retired now, but he was a sports medicine pediatrician. He hired me my first job out of grad school. And he looked at me the day one, he said, I don't care what you do, just don't screw up. And I was like, okay, I don't really know what that means. But as I started working for him, what he meant was, you have a 10,000 square foot training center. You have access to hundreds of middle school and high school kids. Go play around, go be the best you can be. Just don't kill anybody, right? And that was kind of the idea that we had in that facility. And it was so good for me at an early age because I wasn't scared to screw up. I was just had free reign to go out and try new things and do what I thought was best. And not everybody has that luxury of having a medical supervisor that thought that way. But it was really good for me early in my profession. And so I think that's what, again, kind of has always led me to try to be more of a thought leader. And, but then I also say there's times I've talked with a couple of companies I work with, they're like, hey, we want to be innovators. I'm not sure we want to be that far out there in front of things. So, there's a middle ground there for sure, but we need to know the research to kind of bring this home. We need to know the research, but also not be afraid to step out and try the new stuff. So I can't really define what that looks like, but I always encourage young people, let's try new stuff. Let's have fun. And maybe we stumble across something really cool. And then 99% of the time we're going to fail at it, but that's okay as long as we don't hurt.
In sports medicine, we talk a lot about recovery, but not all recovery tools are created equal. Mark Pro isn't just another muscle stim unit. It's a recovery technology trusted by elite athletes, athletic trainers, and rehab professionals. Whether you're grinding through tournaments, back-to-back practices, or long clinic days, Mark Pro helps your muscles recover faster, perform better, and feel fresher tomorrow. By improving muscle activation and promoting natural circulation, Mark Pro clears out fatigue and accelerates your body's natural healing without soreness or downtime. Use Mark Pro to stay ahead of fatigue and keep performance consistent, because in sports medicine, recovery is performance. Head to markpro.com and use the code TOTHEBONE for an exclusive listener discount. That's to the bone at markpro.com. Mark Pro, the best in recovery. You work hard. You train hard. You take care of everyone else. But when was the last time you treated yourself? That's where Soar Soap comes in. Created by athletes for athletes, Soar Soap is an all-natural recovery soap that helps wash away soreness, inflammation, and fatigue. With ingredients like peppermint, eucalyptus, and activated charcoal, it's basically self-care disguised as a shower. Whether it's after a long training session, a tournament weekend, or just a tough day, Soar Soap helps you reset, recover, and smell amazing. Because taking care of your body shouldn't stop when you leave the gym. So go ahead, treat yourself. Head to soursoap.com and use the code TTB15. That's TTB15 for 15% off your order. Because recovery starts with you.
Yeah. Well, and I think a lot of people forget that the science and experimentation has to happen before the research actually is created.
All the research, it all starts with case studies, right? And we don't get case studies if we don't try new things. So couldn't agree more, right? But the research is all 3 years old, right? That's stuff that was happening a long time ago. I shouldn't say it. It's better now with the digital age, and we can submit stuff faster and get things out faster. But still, the research we're reading, the brand new stuff is still dated. So yeah, we just have to keep trying to innovate and try new things and let the research follow us.
Definitely. So with the prevention and performance side of your job, every athletic trainer touches on that, but I don't know if a lot of us actually get to concentrate on that. So how did you kind of develop this position, and how does this shift towards the holistic continuum of care in athletes ultimately?
Yeah. So I have always defined myself as a strength coach who happens to be an athletic trainer. And I don't practice that way as much as I once did. And there's kind of a reason with the evolution of my career. But I played college football back in the late 90s, early 2000s. And I was a strength coach first just because of that background. And then because I was playing football, I had to wait until grad school to really get all my athletic training education. And if you looked years ago at my rehab, it was very much exercise driven and really looking at periodization, load, things like that. Now, as time has evolved, and I've really honed in a lot more on manual skills, nervous system, and managing those kinds of things, my rehab looks a lot different now. But I do think, unfortunately, our educational system makes it hard to have that performance mindset. And when I got hired at university, 18 years ago, that was the number one thing that I was actually hired for, because at the time, our strength conditioning staff and our athletic training staff here didn't talk at all. They hated each other. They couldn't get along. And you still see that in a lot of situations, which is unfortunate. So I was really brought in because I had been a strength coach. I was also an athletic trainer. I could kind of speak both language. And I was like the buffer in between, helping everybody out. And then over time, we've really grown together. But one of the things that we talked about early on here with the sports med and the athletic training staff was the performance mindset. And I think our education system is designed where we see ourselves in the athletic training profession as we're here to make sure nobody dies, right? We're here to handle all the injuries. But so it's sort of like cleaning everything up, right? I would prefer we look at ourselves through the performance mindset, that we are truly part of the performance team along with our coaches and our strength coaches. And when we do that, then suddenly it's like, okay, our job is to make sure our athletes can do everything possible every single day. Because if there's a day that they can't lift or they can't run or they can't train or whatever, that's one day they could be getting better that they're not. So when we look at it that way, it's like, hey, maybe they're in the training room for an injury or whatever else, but how can I help them to perform better today and tomorrow and the next day, reach that long-term goal? And so I think once we at least just flip the mindset, that's the first step of let's be more performance minded. How do we get our athletes to perform every day? That starts to open up the door then to a little different approach to sports medicine versus just being reactive and I'm here to clean everything up. And so when we look at it that way, then suddenly we start working together with everybody. And that's a huge piece, right? As we start working together with our strength coaches, our sport coaches, because they start to see us on the same team versus, unfortunately, there's kind of been some separation between the two. Uh, I really choose to try to bring my strength conditioning background in whenever I can. And if there was something that, I mean, there's several things I'd like to see different about our education system, but I would like to see young athletic trainers have more basic knowledge on how do we progress people long term through a strength conditioning model? What does exercise technique look like? How do I get them through Olympic lifting techniques? A lot of the stuff that they sort of get exposed to in the undergrad program, but there's so much stuff that's being covered in, I shouldn't say an undergrad program, the grad program now, but there's so much stuff that's being covered in those 2 years that they don't get any of it. So, or much of it. So then it becomes completely foreign to a lot of people. And we just fall into this thing of being reactionary. And that's not conducive, I think, for the long-term outcome for our patients.
So with your bridging aspect, I guess in the hiring process, should an athletic trainer be on the coaching staff? Should they be on administrative staff? Should they be on the healthcare staff? This question's been brought up a lot, and I'm not sure where the best hiring position or department should be. What are your thoughts on that?
That is, yeah. So now you're going down a rabbit hole there a little bit. I think there's value to all of them, if I'm being honest. But I think we as athletic trainers need to be careful about where we position ourselves there. And I think every school runs it differently and every situation is a little bit different. I do know some schools that their athletic trainers are hospital based and they work for the local hospitals and they love it and they do fantastic. I think there's some positives there. A lot of times those athletic trainers make a little bit more money. It's great. Benefits might be a little bit better. There is that separation between the school and the hospital, but so that can be good, especially if there's coaching changes and things like that. But I also think that working for the school, which is what we do at Missouri State, like I am an athletic department employee. I don't work for our student health, anything like that. I report directly up to the athletic director. We're all on the same team. We're all in this together. I think there's a lot of value to that team approach. Now, at the end of the day, could our coaches come to my administrator and say, I don't want to work with Mitch anymore and we'd have to make a change? Probably. We don't really have that issue here, but we've seen some of that in the past. And that can put us in a difficult spot. I think a lot of it comes down to though what we want. I mean, I think we're seeing at different levels. So we're seeing an evolution in recent years of especially the big programs like P4 programs where head football coaches get to create pretty much their entire staff and more, including their sports medicine staff. I think the good of that is if you want to be in that setting and you're don't care, you're open to job insecurity because you're going to go as that coach goes, great. But you're probably going to make a little bit more money in the short run. I don't know that that's great in the long run, but if that's your lifestyle, go for it. Where you get down to like mid majors, where I'm at, there's a lot more stability in the sports medicine staff, a lot more separation. That's what I've been comfortable with, still being able to compete at a high level. So I don't know, honestly, that I have an answer. I can tell you a lot of the athletic trainers that I know that are more on the education side of the universities, they look at it sort of, I mean, I've had several have tried to talk me to that medical model of we should work for the hospital, and they think that makes a lot of sense. In our situation, I don't want to do that. I don't. I like where we're at. I think the benefits I get at the university are much better than I could at the local hospital. So I think it becomes sort of an individual situation for that school, that hospital, that setup. And then I think for us as athletic trainers, we just have to decide what's our priority: job security versus hours versus pay. Those are all factors, benefits. Those are all factors we have to weigh out. I don't think there's one answer across the boards, if I'm being honest.
Yeah. Well, I had this conversation last week too, and it was, well, if you're at the hospital, it's very secure, safe, but you're not going to actually achieve an athletic training mentality, if that makes any sense. You don't get
It
the
does.
flexibility.
Absolutely.
You don't get to, you have to clock in, clock out. You don't get to get overtime. You're going to have to work the whole year instead of maybe having a lighter summer, heavy season. It's
Yeah.
just thinking about all the variables on it. And I don't think there's really a true safe employing department ultimately.
Yeah. Well, no, I couldn't agree more on that. But I also, to your point, right, of when you work for a local hospital or maybe there's a partnership or whatever, yeah, you're probably going to be protected a little bit more in certain regards. But then I question why people, most of us get into athletic training because we want to be on the field all the time. We want to be with the teams. We want to get to know our athletes. And if I've got a hospital saying, well, you can't work more than this many hours, or you're not going to go here or whatever, I think it limits us. And I am of the mentality that I don't mind. Like right now, September, October, we're buried at the university because it's football season, it's volleyball
So
season, yeah, everything, right. And all of our spring sports are also in their fall season, and we're getting pummeled. But I'm cool with that because I know when December and January hit, it's going to be super chill. And same thing over the summer. Summers aren't as chill as they used to be, but I like the up and down. I don't get stagnant that way. I would get bored if I was constantly working 40 hours a week and kind of being shuffled around to other places. I'd rather just be in it with our guys and be a part of the staff. And I love it when our coaches consider us part of the staff, and we get all the gear and we get the championship rings when we win, and we get like that. To me is the perfect setting. That's what we should be looking for as athletic trainers.
Mhm.
That's why most people get into it. And not that I'm against the industrial setting or some of these other settings that have really evolved over the years, but for me, that's where I want to be. And I'm cool with the ups and downs. And as long as there's give and take, I don't have an issue with any of that.
Yeah. So looking at the team dynamic in the athletic training room, how you're more concentrated on the prevention and performance side. Looking at the education spectrum, do you think we should have specialties within the master's programs of concentration? And then looking at the team that you're working with in your athletic training clinic, do you think that there should be a specialist in rehab, a specialist in emergency care, doing field coverage, someone that's specialized in manual therapy? Obviously, everybody can still do everything, but do you think that's a better flow ultimately, even just trying to get hours and boundaries and making sure people get time off? Do you think, what are your thoughts on that, I
Yeah,
guess?
I mean, I think it's a great question. And I will say, just like looking at our staff here, what do we have? I think 18 now, something like that, between full times and interns. I don't think the current master's level education gives young athletic trainers the skill set and the experience they need to walk into, especially the college setting, and be proficient. And I don't mean that to be mean or negative. I think that we are being now currently stretched in so many different directions that it really puts young athletic trainers in a difficult spot. So when you look at what the NCAA is forcing on us with regards to, all the stuff, mental health, all the, being a part of a lot of the different workouts in the off season, being present. You look at, yes, some of the performance things that we can entertain, the rehab side, Ethan is a guy who sutures, right? And I do a ton of dry needling. Like those are skill sets that I don't think should be taught at a basic education program. So if we're going to develop those things, then they have to come afterwards. Well, I think that only makes sense if we're going to sort of specialize a little bit. So kind of bringing it back around to your question, I think it's unfortunate we've been forced to sort of move away from the traditional grad assistant model. I thought that system actually worked really well for the profession of get your undergrad, go to 2 years of grad school. That's where you get your master's degree paid for, and you get 2 years of experience. Where now we aren't hiring people in the Division I college setting unless you've got a couple of years of experience in this setting post graduation. How do you get that? Well, you end up going to work, like we hire these interns, as we call them. Some people call them fellows, whatever else. And we don't pay them very well, and they're expected to come and get experience. I don't know that that's great for our profession the way it's set up, because now we've delayed that earning another couple of years. Plus, they have extra student loans from the master's level education, and we're graduating less athletic trainers than we ever have. So now there's a shortage. But I do think there's room in a staff, especially if you have a good sized staff, where I can be the rehab guy. We have one of my coworkers, she tends to really focus on our mental health. And so she is an athletic trainer. Yes, she's assigned to several teams, but she doesn't do a lot of coverage, but she manages all the relationships with our psychiatrist, our psychologist, our various counselors that we have, the counseling center on campus. That's her area of expertise. We have one of my coworkers that tends to really focus on concussions. So when we have the long-term concussions, guess what? You're going to do the SCOT and you're going to help us with those therapies. And so I do think more than ever, there's going to be some extra sort of specialization. And the idea that we just have athletic trainers that go out and cover sports and come back at the end of the day, I think is a little bit far-fetched, because the expectations are just too high now. And even when kids come out of college or come out of high school, it's interesting. It's no longer good enough for me to say I'm a Division I college athletic trainer and I have trust. All these kids come out of high school now. They have their pitching coaches, they have their strength coaches, they have their PTs, they have all these people they've had access to all through high school. So when they come to us, we have to meet or exceed those expectations or they won't buy in. And so because of that, then I can't do everything. I can't be a part of everything. So I think there is some room for some specialization, but you have to have a staff that's big enough to do that. And that's where I think it's hard. If I were to work at a Division III school or an NAIA school, man, it's just kind of survival for those guys. And I feel for them, but at least a minimum, they have to have people they can refer out to within their networks and their communities, because they can't be expected to know all of those things.
Yeah. Well, I had thought that the master should kind of go to a third year, not to add more schooling, but it's almost a working internship, the GA-ship that you had mentioned, where you're still a part of your educational program, but you can come back to them with questions and you're still learning. That's, I think, where you could do a specialization course or tract or something like that. I'm interested in these 3+2 programs that are coming out. I'm still kind of worried that high schoolers are just not learning how to be students at this point. So I'm not sure if escalating this track is really the best option. So I think we have to address more of kind of where the students are coming from this point. I think we're at such a hinge point where the masters really could have been, well, it's good, could have been better if COVID didn't happen, first off. And then secondly, technology, I think, has hindered the mind of openness going into programs and having, street skills or just common sense to an extent.
Yeah, no, I think those are all great points. And I think to add a third year is interesting to consider. I think you get a ton of pushback, even though it's probably the right thing to do, because nobody wants to go to school for a seventh year now.
Yeah.
And I think where I struggle with, well, your 3+2, I agree with everything. I think that a 3+2 is hard, because do high school kids really know what they want? And do they really have the skill set to jump into these things at an earlier age? But I understand that from a recruiting perspective, they're trying to, program directors are trying any way they can to get kids in the programs, and they have to. I think where we're really hurt, if I'm being honest, by the master's level education is we used to have, the undergrad program, and we knew that some of those kids would go on to be dual credentialed as a PT or PI. My wife is a perfect example, and she's a physician assistant, has worked her entire PA program or career in orthopedic surgery. And, but she was an athletic trainer for 4 years before she went back to PA school. Now,
Mm-hmm.
I've heard people say, well, we don't want those people because they're not invested in the athletic training profession. They just wanted to this was a stepping stone to go to PA school. Well, I argue that our profession got 4 years out of her as a really, really good, smart athletic trainer, before she went to PA school. Like,
Mm-hmm.
there's value to that for our profession. And I fear that we're going to continue to struggle to get really good students into our programs, because at the end of the day, if I'm coming out with my undergrad and I've got, say, a biology degree and an exercise science degree, and I'm looking at, well, I can go to athletic training and I can make, 45, 50, maybe $60,000 a year, depending on where I end up, right? Or I can go to PT school for not a whole lot more education and I can make, I don't know, 80 or whatever else. Or I can go to PA school if I've got good science and come out making 120 or 150 for 2 years. Or if I'm really good at chemistry, I go to anesthesia assistant and start at 150. Like, where does that position us as a profession to get the best and the brightest? It doesn't position us very well as an athletic training profession. So I just think that that's hurt us. And so, when I hear a lot of athletic training programs are an acceptance rate of 100% of the people that apply, I don't know that that's really helping us that much. So I do have some concerns with our educational program. I don't
Mm-hmm.
know how we fix it at this point because I don't think we can go backwards. Call me old school, but I really thought we were in a sweet spot with the undergrad program. Kids came out with more experience, and then we could put them in a GA position if they wanted to be in the college setting or specific setting, and allow them to get the experience while not incurring more debts. But we're here, so I don't know what we do to solve it, to be honest.
Well, and I think that's the bachelor's. You could go get your certification and then specialize after that with whatever master's you wanted. And I think that was kind of a hindrance also. I did the master's route and I saw it as a negotiation point for compensation and stuff because I had the master's degree already, but that power has been taken away. I've talked to other people about this. Kind of sounds like going in reverse, but since there's a shortage, why wouldn't you have a pre-athletic training bachelor's where it's more emergency medicine on EMT, paramedic kind of parameters? You know, there's so many events going on, not saying that you have to be a PRN athletic trainer, but there's always the capability to do that while you're doing your master's. And then you can work on the rehabilitation, prevention, more the physiology of anatomy of injuries and biomechanics, and really streamline the knowledge. So that's been my idea, but that sounds like we're taking a full step back ultimately.
Yeah, you are seeing some undergrad sort of sports med programs that are kind of pre-athletic training coming about. I do think it's an interesting concept to think about of, could we equip them with enough knowledge to be able to cover a weekend soccer tournament? I think you could, right? Because let's be honest, I mean, it, for me right now with 20 plus years of experience, if I were to go cover a youth soccer tournament on the weekends, I might, I'm going to hand out a lot of ice bags, a lot of Band-Aids. I might tape a couple ankles. But at the end of the day, I'm not going to make any real return to play decisions for those people because I don't know those kids. I don't know mom and dad. I'm not going to stick my neck out there on my own licensure. So really, you're out there kind of acting as an EMT with some specialized knowledge in the sports medicine world. So I definitely think you could do that. And I will say this, I think another mistake we've made, and I feel like I'm being really negative on the athletic training profession. I do love our profession in a lot of ways. There's a lot of days I get frustrated with what I do, but there's a lot of days I wake up, I'm like, you know what? This is really stinking cool. On game day, when I'm standing at the 50-yard line, in the Coliseum, we're playing USC, I'm like, this is awesome. This is great,
Yeah.
right? So I want to be clear on that. But I do think a mistake that we have made as a profession that I don't know how we solve this either, but we have put ourselves, especially you look at like the high school setting, where
Mm-hmm.
people view us as almost like an insurance policy, right? So
Check in the
local
box.
schools, right? Local schools look at us and go, well, we don't really want to pay for this position. We don't really know where they bring value to our school system. But I do know if that a kid gets injured in a football game seriously, and I don't have an athletic trainer there, we're going to get sued and we're in big time trouble. If we look at it through that lens, then it's like when you buy your car insurance, right? I don't know about you, but I really don't pay attention to who I'm buying my car insurance from. It's like, what's the cheapest option I have? I'll take that. That works for me because I hope I don't have to use it. Well, for us, then we become the race to zero because now it's like, well, who's going to do the job for less money? I'll just take them because I'm really just checking the box because that's all I need. Where we have to somehow show more value in that situation. What is our value proposition for covering a weekend soccer tournament for a local municipality as, an athletic trainer? I don't know how we solve that, but maybe that does become a situation of we have a little bit lower end education to allow those people to do those things than the rest of us, kind of have something that differentiates us to demand more money.
Hey friends, quick break to talk about something that's changing the game in sports medicine, red light therapy. We're talking real science and results. There are over 4,000 research papers showing how light can help with inflammation, pain, tissue healing, swelling, and musculoskeletal conditions. The team at Fringe took that research and created red light therapy tools designed by rehab experts and sports medicine professionals, built to deliver light directly to the tissues that need it most, promoting healing from the inside out. And get this, no wires, no EMF, no flicker, and absolutely no bad vibes. Whether you're running a clinic, working in an athletic training room, or recovering at home, these tools are a game changer for performance and recovery. Check them out at fringeheals.com and get 10% off with the code TOTHEBONE10. That's to the bone 10 for 10% off.
Well, and not that I want an athletic trainer to be paid less, but at the same time, for these tournaments, you're only using a segment of these skills that we've learned in our 6 years of education now. And that's where they should be able to charge a little bit less than a full-time position because really, yes, it all compounds together, but really, I'm there to make sure nobody dies and get somebody off the field to keep the schedule going. So, and we have to realize is that we've minimized our responsibilities in these different settings in that PTs are now starting to get their emergency care certification so that they can cover events. EMTs are starting to encroach because there's just not enough athletic trainers. So if we want to keep these markets, we have to figure out something else. I mean, I know that Wave On and Elite 7 are putting together the virtual athletic trainers so that you can continue the care after the event, which I think is what has been missing ultimately, is we try to take on these athletes after we meet them once in an emergency situation and try to continue care. But at the same time, you still need physician oversight to do that. So we kind of are boxed in with that. So, I mean, these online platforms are opening that up, and I think that will be the next step of athletic training. But I just can't believe it's taken us that long to really kind of understand that continuing of care is what we're the best at.
Yeah, no, I think you hit a nail right on the head. And I love the fact that athletic trainers, when we come out, we are sort of the jack of all trades and we can go work in all kinds of different settings. We can go work at Amazon. We can work in the military. We can work in the college or high school setting. We can go into the clinic. That's cool. But also we have to remember that when you're a jack of all trades, people don't consider you a master of anything. And that's where I think we're really hurt right now is nobody really knows where to put us. They're like, yeah, we can have an athletic trainer do all these things, but then, how do we really justify the pay we want or the benefits or the time or whatever? So we kind of just get hammered because nobody knows what our specialty really is.
Yeah. And that's one of the conversations that I've been seeing a lot on LinkedIn is, well, what is the one skill we have that doesn't really overlap with other professions? I mean, with you have the strength and conditioning, which overlaps very heavily, but are we really encroaching on the strength and conditioning, because I feel like you are approaching it from a different aspect ultimately, and not every strength and conditioning coach can do what you can do with the athletic
Correct.
training
Yeah.
background.
Right. Yeah, I mean, and just to use that as an example, right? I've always considered every athlete falls on a continuum, right? And so on one side of the continuum is like they're injured, they're on the table, or maybe they're like a really overweight youth kid that can't do anything effectively. On the other side of the continuum, you've got your Olympic gold medalist, your NFL Pro Bowl guy, right? And you've got everybody
Mhm.
falls somewhere in the middle. Well, clinicians tend to be really good at the one end, but they hit a point where, well, let's see, you're too good to be on the table in the training room. I don't really know what to do next, so we're going to send you over to the strength conditioning guys. Well, they're great at the high end. They're really good at running, planning, jumping, cutting, all those things. But there tends to be a disconnect in that middle ground where there's a gap where they're too good to be in the training room, not good enough to be in the weight room. And that's where kids get lost. And that's where athletes end up falling through the cracks. The goal should be to have the overlap instead of the gap. And that's where I've always felt like that was my niche is I can overlap and talk both languages. And I will say, I think the strength conditioning world that I have seen, what I've seen in the last 15 years has done a really good job of learning more medical knowledge, almost too much, where some of them overstep their bounds a little bit. I think we need to be better about getting up to that strength conditioning side. So now there's this middle ground where like, hey, I can go do that if you want me to, or but no, I'll do it. Hey, I got this today, and we can just go back and forth because that athlete's in the middle, and we both know what's going on, and we're both able to continue to progress them. But historically, there's been a huge gap there, and that's where I've always been passionate about trying to fill that gap. I think we're better, but I still think on the athletic training side, we need to be better to get from those regressions to the progressions. Because I think the strength guys are working hard to get from the progressions to the regressions, and we need to work better in that way.
So, question for you. I've always felt like it was kind of silly in preseason when we have all these fitness tests and stuff, and you have kids, athletes that don't pass these tests, even though they had all summer to prep for them. What are your thoughts on athletic trainers? I don't know if disqualify is the right word, but hold those athletes back to make sure that they are reaching their fitness goals before going to 100% on the field with the rest of the team, if that makes any sense.
No, it does make sense. I think, at least I think the question you're sort of asking is the athletic trainer, do we play a role in that process of making sure that they're fit and ready to go before they practice? I think in an ideal world, they do. It is in our, at least we play a partial role in that. I would say, at least at our institution, that our coaches are the ones that primarily drive that. And they're the ones that hold our athletes accountable. But I don't know why we can't play a part in that as well. Because if you look at the health and the well being of the student athletes, that's our job, right? And if they come in and they're overweight, out of shape, or just deconditioned or not acclimated to the heat, then we're putting them in a bad position by clearing them to go play. It's not something I think traditionally has been done a lot of, but I think it definitely could and should be done. But I think more practically speaking, that just comes down to the collaboration again of being part of your coaching staff and being considered part of that staff where that if you have that really good collaboration, we're all on the same page and know what the expectations are. And we sort of intuitively play that role, even if it's not necessarily assigned to us. I will say that's where I think we've evolved here, at least at our institution. Plus, I also think, too, in the college setting, it used to be 10, 15 years ago, we probably had 85% of our athletes go home over the summer. Now I would say 85% of our athletes stay all summer. So naturally, they already, when fall camp starts, they're fit, they're ready to go. And we know that because they've been here all summer. But for those athletes that go home, yeah, I do think there should be a role for us to be able to say, hey, I think we need to be careful about how we progress them based on what I saw during that evaluation to make sure that we're not overdoing it.
It's something that's always been in the back of my head because I was at Division 3 and, and it was Caltech. So athletics was not necessarily at the forefront most of the time, and they were at internships all summer. So, we'd have this big group of athletes come back, and half of them didn't pass any of the standards that were set or um, their standards from the previous season. And then we just let them go, and then they'd get hurt. And it was like, well, I think there should have been some steps before just letting them go instead of just,
Sure.
you didn't make it. Let's
Yeah.
keep
No,
going. The
absolutely.
roster's small or whatever.
Yeah, no, absolutely. I agree with that completely. And whether that comes down to us stepping in or we collaborate with our coaches, I do think that conversation needs to be had for sure.
Well, we went like everywhere, but what I kind of thought we were going to talk about, but that's fine.
That's all right. That's
We had some
I love it.
interesting things.
We just get growing and we get rolling on things.
So, do you want to talk about technology and innovation
Yeah.
in sports medicine? I mean, you approached me about fringe and the red light therapy. Why don't you, whatever you want to go with
Yes.
after this?
Yeah. Well, I'm just thinking if we aren't already, we better get comfortable with technology, right? And so
Yeah.
I think more than ever, we're seeing, like I've already mentioned, like force plates being an important part. It's not hard to get handheld dynamometers now that are pretty cool. They give us tons of data and tons of information. And you look at GPS tracking, you look at all the different accelerometry. Well, I shouldn't say most, a lot of athletes, even coming down to like, Aura rings and Whoop bands and things like that. That's all really valuable information that we better embrace or it's going to pass us. And I think for athletic trainers that aren't knowledgeable with a lot of these different platforms, we better get knowledgeable because that is just the way it's going. And I think it is ultimately good. I mean, I can tell you over the years, I've been able to settle down some pretty good overzealous coaches with data and prevent some overtraining. I've also, on the flip side, been able to expose some of our coaches to some undertraining in some situations or some poor season management by looking at technology and data and showing that maybe our vertical jump is falling off in the midseason. Why is that? Well, maybe we should be lifting more. Maybe we're not fueling our bodies well enough. Maybe we're not recovering enough. Like, there's a lot of things we can do. So I think the technology overall we have to embrace if we're not already. Now, with regards to Fringe, that's one of the companies I work with, and I love them to death. And one of the things they've really expanded in recent years is on red light therapy, and that is an area. We spoke early on about ice, right? And so we always kind of say internally that red light is the new ice, and I think we're seeing a really good evolution. The science supports that we can use things like red and near infrared wavelengths of light to control inflammation, to help mitigate, basically have some antioxidant properties and take care of free radicals and a lot of these things that we've had some trouble with before, but not do it at the cost of tissue healing, right? So you look at just, and I don't want to pick on ice, but just to use it as an example, we know it helps with pain relief, but it also decreases that inflammatory process. It decreases the blood flow to the area. Well, those aren't necessarily a good thing, especially when we start talking about tissue healing, right? So I don't necessarily want to decrease blood flow to an area. I certainly don't want to slow down the inflammatory process. We have to get through an inflammatory process in order for tissue healing to take place. So red light therapy steps in, and when we expose our cells to the proper wavelengths of red and near infrared light, we know that accelerates ATP production by the mitochondria. When the cells have more ATP, they have more energy, they become more efficient what their job is, and suddenly things get better. And I've seen it over and over and over again that athletes are able to recover very quickly and efficiently. And it's just super easy. Now with the red light wraps that are out there, we can travel with them. They're battery powered. We can take them on airplanes and buses, and our athletes can take them home. And most of that is being built off of the technology that cold lasers started 20, 30, 40 years ago. And I've always been really fascinated by cold lasers and the research that's behind them, but I could never afford a $25,000 or $50,000 laser. Well, now we understand that light is light, and the bodies can't differentiate, the cells can't differentiate whether that light is coming from a $50,000 laser or a $200 LED wrap. And so that's where I think the technology is super cool, that we're just seeing this evolution of light therapy and sunlight being used in different ways. Essentially, the good properties of sunlight. So I've become a huge fan of red light therapy in the last few years, and we use it on acute injuries, chronic injuries. We use it for brain health. We use it for gut health, all kind of wound healing, all kinds of different things. And we've had tremendous success with it.
So I'm a big fan of red light also. But, when you go to Amazon and stuff, Fringe is obviously a good brand, but sometimes cost is a factor or accessibility. So how, when even in general for modalities, how do you determine what's a good quality one? I know with red light, there's the different wavelengths to get the different penetrations and stuff. How, I mean, for an athletic trainer, we can kind of sort through that stuff a little bit, but as a regular person, how do you differentiate China made knockoffs compared to stuff that's going to actually work?
Well, valid question. And for one, I think most of them are made in China, regardless. So it's whether they fall off a truck or not or whatever. But I think that when I tell people, yes, I work with Fringe. They're a reputable brand. They do all the things right. Does that mean you have to buy red light from Fringe? No, there's other good products that are out there. There's no question. And even some of the really expensive or inexpensive products that you might find on Amazon, I'm sure they're really good. I just don't know. And so that's what I always tell people is what you need to remember is wavelengths of light matter. So nanometers matter. We need to be for red light, we need to be in the 650-ish range for nanometers. For near infrared, we want to be about the 850 nanometer range. And both of them have different or the same healing properties in our cells. They produce more ATP, antioxidant, anti-inflammation, all those things. But near infrared penetrates about twice as deep as red. So it'll penetrate up to 2 inches. Well, if you can find that, great. As long as it says, hey, we've got 650 and 850 or right around that range, then you're good, as long as we know that we can trust them. Now, I will get in. I mean, there's another argument to be made of there should be third-party testing that's done if we really want to feel good about it, which I agree with. And Fringe posts all their testing right on their website. But if you can find that and feel confident with that information, great. The next thing I would say is you need to try to figure out what the ratio of near infrared and red light is. So I prefer a ratio of 2 parts near infrared, 1 part red if I'm looking like at a red light wrap. So if I have a red light wrap, I'm going to put right on my shoulder, right on my back or whatever. Well, I want to penetrate as deep into the tissue as I can. So I want twice as much of the near infrared lights versus red. Again, try to find that. If you can find that information, great. If you can't, then I start to get a little bit nervous. Then the last component is the intensity of light. And so some people will advertise, we have the most intense red light out there. That's not necessarily a good thing. You can overstress the cells. Too much of a good thing is a bad thing. So what the research says, you want to be somewhere between 5 and 50 milliwatts per centimeter squared. I know that sounds really sciencey, but at the end of the day,
We all used ultrasound at one point.
right? At the end of the day, that's what we're looking for. We want to mimic the sun, which is right about 37 milliwatts per centimeter square. We're talking about red light. So if you can find those parameters, so I would just encourage people like those, if you can find those 3 parameters on whatever you're buying and it fits, then get it. Whether it's $50 or $200, that's fine. I just get nervous if I can't find that information just because I just don't know what I'm going to get. And so it's sort of like the supplement industry, right? There's amazing supplement brands that are out there do awesome work, and I love them to death. We work with Titan Nutrition here in Missouri State, and they're amazing to work with. But then there's other companies like if I don't know what's on the label, then I'm going to be really nervous about buying it. So I just kind of get into that same kind of a mindset where I try to get educated as much as I can on the product I'm buying. And if they won't share that, then I'm probably going to go somewhere else.
Yeah. Well, and that's, name brands have a name brand for a reason, is they've done the research, they put in the money to validate their product and stuff. So sometimes the name brand is the way to go if you have to pay a few
For
extra
sure.
bucks ultimately.
For sure. And I think that, there are name brands out there that are like really good at marketing, but not so good at producing. And that's tough,
Mm-hmm.
right? It's tough to figure out what those companies are. But by and large, usually the better known brands, I do think tend to be better known for a reason. And especially if they're not being pushed by some celebrity or something like that. If they're just a good known brand in the medical world, then I think you need to pay attention to that.
So you also talked about overstressing the cells. What is the best exposure time with the red light therapy?
Yeah, so a typical treatment, especially when you look at the red light wraps, is about 20 minutes. That's going to
Okay.
give you typically the dosage you're looking for to land in that therapeutic dose. But the more acute an injury, the lower dosage you want. So that's where I encourage people to be like maybe 10 minutes with a fresh ankle sprain or a post-op patient. But the more chronic, so think like tendonitis, tendinosis, Now we want to blast that tissue. We want to be more like 20 to 30 minutes and do that every day. So you don't want to go more than once a day, but for the acute stuff, maybe 3 to 5 times a week. For the chronic stuff, more like 5 to 7 times a week. For a shorter duration for the acute stuff, a little bit longer duration for the chronic stuff. But for most athletic trainers that are working with young, healthy, neurologically intact individuals, 20 minutes daily is a pretty easy rule of thumb to go along with. And most of them will tolerate it really well and get really good healing out of it.
Gotcha. And then you had mentioned about head injuries, like concussions. Do you wrap a red light around their head, or do you actually have the mask?
I apologize. I'm in a room. I don't have our the fringe red lights head wrap. They actually have a wrap that fits onto your head and it comes down and
Okay.
covers really well.
Kind of like a cap.
Yeah, it is, and it looks funky. When I first got mine, I brought it home and I'm laying in bed at night. I like turn the red light on, the lights are out, and it's like glowing out of my head. My kids just start laughing at me, making fun of me. What are you doing, Dad? And I'm like, well, I'm just trying to make sure my brain's working. But there are some other units that just have a deal that straps across the forehead. And what the research says is that contact across the forehead is the best for brain health. There are some also intranasal units where they actually shove the red light up into the nose. And the thought on that is that it works because the original thought was I can actually expose the brain to red light. The reality is that most people are actually kind of evolving to is you're probably just exposing a ton of red blood cells through your sinuses to it, which are circulating into the brain and giving that extra help. But the reality is very few patients and athletes will tolerate having those shoved up in their nose. For those of us that remember the horrible testing days of athletics during COVID, where 3 times a week we were shoving everything up our nose. Like, I don't see people wanting to do that. So that's why we've really gone with more of the head wrap. I will also say too, since we're getting into the weeds here a little bit, if you're going to go looking to help with brain health, you also probably want to build a third wavelength of light in there. That's going to be more like 1050, and that's going to penetrate through the bone really well, the skull, to get to brain tissue. So it's going to penetrate even deeper than that 850 nanometers. So that's another little wrinkle to consider. But red light therapy, generally speaking, when you look at the literature, is shown to be really good for like autism, anxiety, depression, some interesting things coming out on headaches, chronic concussions, or CTE type stuff, Parkinson's, multiple sclerosis, really good healing properties on all these various conditions.
Okay. So if somebody went to Fringe, do they have all three spectrums, or do you guys categorize them?
No, so on the head wrap, all three lights are built in. So each one of the LED diodes has 650, 850, and 1050 when we're looking at the head wrap. The other wraps, there's various sizes. We've got a regular wrap and an XL and a multi-joint. Those all just have 850 and 650 built in. And the 850, there's two diodes there for one. So it's 2 parts near infrared, 1 part red, and all of those. And we're just trying to follow the science and create things that are easy to use and really accessible at a good price point, but are very evidence-based.
So what innovations or cultural shifts do you think will define athletic training in the near future?
That's a good question. I think we as a profession, athletic training profession, are going to continue to play a larger and larger role in mental health. I've said this for a long time. I think for the college athletic trainer, most of us spend a big chunk of our day managing mental health, and not in ways that people always define it, but just the ups and downs of college athletics and how to handle being a part of a team and teammates and coaches and time management and anxiety, depression, all those things. But all those things are continuing to grow. We've been having an interesting discussion kind of internally with our staff of, I think it's interesting, this generation of young people have more access to mental health resources than ever before, but yet they seem to have more and more challenges with mental health than ever before. And I think there's a whole lot of reasons behind that we won't get into in this discussion because we'll never solve that problem. But I do think as frontline healthcare providers and very trusted individuals by our athletes, we're going to continue to see our need for mental health skills and knowledge to just continue to grow. So I think if we're not comfortable handling difficult conversations with mental health as an athletic trainer, we better get comfortable because it's just going to continue to go that direction.
Yeah, I have definitely noticed that over the last few years. And I think COVID kind of exacerbated some of it.
Yep.
But at the same time, it seemed like it was still relevant before COVID too, or was starting
Yeah.
to pop up.
No, I agree completely. I think it was there pre-COVID, but it definitely got exaggerated during COVID. I mean, it's just COVID poured gasoline on that. And I hope we sort of get that back as that generation continues to kind of work through all of our various levels that we work in. But I think there's other things we're never going to change of social media and the youth sports movement that I think has some positive things, but has a lot of negatives and for kids later in life. And so I just think all of that, we're not going to change those things. So we as a profession have to make sure that we're prepared for anything and everything on the mental health side because it's just going to continue to be put on us.
What projects do you have coming up that you're involved with? Can you spill any beans?
Yeah. So, well, I'm really all in on the red light stuff. I do think I'll tease this because we're really close at Fringe to launching this, but we're going to be soon launching a red light mat, which I think is super cool. So it's going to be like the size of a yoga mat, but it's going to have a lot of red light embedded into it, and it's going to be super affordable and easy to transport and things like that. I see it as, some facilities are buying red light beds or like look at the tanning beds. And I mean,
Yeah,
people are spending $80,000 on these things and they take up a whole room and only one person can use it at a time. I see
yeah,
these red light mats as a way that we can get the same thing, a full body exposure to red light at a fraction of the price. That's super easy. We can roll it out, use it, put it away, or we can travel with it. So I think that's really cool. I've been doing a lot of work with Tenkata Surfaces, which is a turf and a track company. And so I've been helping them. They've got a brand new turf that is a non-infill turf, so it doesn't have all the rubber pellets, which I'm super excited about. And I've been helping them kind of refine that and grow that a little bit. And so I'm excited to see where that goes. It's just been a different area that I haven't had a lot of knowledge on in the past, but we installed it here at Missouri State on our football turf. And so I've learned a ton through that process. And what's great about them is after we started talking, they're taking a lot of the feedback that we're giving them regarding the turf and how they can get better and how they can evolve it. So that's been really fun. I always love teaching dry needling. To my knowledge, I'm the only athletic trainer in the country that certifies other clinicians in dry needling. So that's always fun just because I get to be, again, kind of a thought leader out there in our world and carry the torch of the cool things athletic trainers do in our profession. And so continue to push out education there. I mean, I think that's exciting as well.
So if somebody had more questions for you, how can they reach out to you?
Probably the easiest way is my email. So Mitch@MaximumTrainingSolutions.com. So Maximum Training Solutions is my education and consulting company I run outside of Missouri State. So MITCH at Maximum Training Solutions, all one word, no hyphens or anything like that.com. And just shoot me an email. And I'm most responsive on email because maybe I'm old school, but I like social media. I don't love social media, so I'm not really super active all the time on social media. But if anybody has questions they want to ask or bounce around or difficult patients or, they want to complain about something, I'm always open to a good conversation. People can always email me there and we can always jump on a call if there's something that we want to get more in depth on. But I think that's the easiest way to get a hold of me. But I'd love to have those opportunities if people are interested in it.
Yeah. After this conversation, you're very open and very thought-provoking at the same time. So I would definitely take advantage of it if you can.
Compliment. That's great.
Well, thank you so much for being on, and I'm hoping to have you on again to talk about more topics in the near future.
Yeah, Shelby, thanks for having me. This has been a blast. I always love these conversations, so I hope we can do it more in the future.
Perfect. Well, thank you for being on the show, and we'll see you in the near future.
Sounds great.
That's it for today's episode of To the Bone. I hope we've sparked some new thoughts, challenged your perspectives, or simply reminded you to dig a little deeper. Remember, life isn't just about what's on the surface. Sometimes you've got to cut deeper and get to the bone of what really matters. To the Bone podcast is a product of Daily LLC. It's hosted and produced by Shelby Daly, ATC, and Randy Daly. No clinical decision-making should be based solely on one source. While care is taken to ensure accuracy, factual errors can be present. For more on the show, visit www.tothebonepodcast.com. If you enjoyed this episode, be sure to subscribe, rate, and leave a review. Get involved in the conversation. You can find us at www.tothebonepodcast.com. Drop us topic suggestions or be a potential guest. We're all about connecting with you, our listeners. Until next time, stay curious, stay grounded, and keep